The father of PrEP, Robert Grant from UCSF, discovered that using an antiviral daily in HIV-negative people could block HIV close to 100% of the time if you use it prescribed, which is better than most vaccines. I mean, it's total miracle work. So having a knowledge of PrEP and U equals U and the benefits of testing and willing to use those tools, we could really end things, both domestically and internationally. And it's wonky stuff, but
It's important.
I don't know where you're at on the learning curve and how we can help going forward.
Yeah, so I mean, I'm there on everything you just talked about. I think where we're still trying to refine our understanding is when we get into the relationship between cost, intellectual property, CDC intervention, and what we have to say about what it would actually take to make these kinds of prophylactics as well as remedies available to everybody who needs them. I mean, obviously, there's a whole complex of things going on, right? But to talk about the most impactful things while some of this stuff is still going on, that's the area where I think we'd most benefit from. Right? I don't need to be persuaded about the importance of evidence-based public health diplomacy, the relevance of making sure everybody is equipped with prophylaxis as well as able to get treatment. I think mainly now I'm trying to figure out, okay, how does this interact with the world we're in on the commercial side, where there are going to be a lot of forces kind of arrayed in order to keep things on a certain trajectory, and keep that from getting muddled in the conversation we're having about healthcare access more broadly. Does that make sense?
Yeah. On the budget side, I encourage you to actually reach out and talk to Governor Cuomo. He announced, it was 2014, he was pushed by his activists to try to use these tools in the state. And formed a task force, and they came up with a highly detailed plan. And it was AIDS activist wish list, but he endorsed it. And it involved real money. But the money's not huge. And we set the goal of ending AIDS, he set the goal of ending AIDS in New York State by 2020, which is only a year away. But we carefully defined that as lowering the annual infections in the state from what was then in 2015 over 3,000 people in New York State every year down to less than 750, which is below the level of annual deaths. So you end what's called epidemic levels of infection as you're beginning to shrink the pool of people with HIV. So it's not ending AIDS entirely, but it's ending epidemic levels of AIDS. And we're kind of on the trajectory. I mean, our data lags by 2 years, so we won't know until 2022 whether we hit the target. But and the money wasn't huge. The money wasn't huge. It involved housing, it involved testing, it involved PrEP campaigns. It's not big bucks. So it's a good lesson.
And interesting domestic data show a patchwork. So coming back to U equals U and PrEP, viral load suppression is worse in those geographies that haven't embraced Medicaid expansion.
Oh, of course.
And we actually have, we meaning the US, has the worst viral load suppression rates nationally. UK is on the other side with that joined up system. So you can see the way in which policies have played a direct role in exacerbating our very unique US epidemic. I mean, it's a stain on the conscience that we even have pediatric HIV anymore in this country. Pediatric HIV doesn't exist in France. It doesn't exist in the UK. It's a public health emergency.
Or New York.
Right. And it's because of a lack of syringe exchange.
Zero babies.
Right, because if you can go back to data from Newark that actually show that the kind of networks that increase a woman's vulnerability to HIV relates a lot to criminalization and the drug war. And so when you take that out of the picture, you actually save everybody's life. And that's what's creating an epidemic of like a barbaric, and any dimension of this is barbaric, but in France, doctors don't even know about pediatric HIV anymore. So that's pretty astounding, right? To contrast it with what still happens here.
I mean, we do a lot of it in New York with Medicaid dollars. But you mentioned Medicaid expansion. Do you have ideas on how to convince the states that have...
It's politics, right? The states don't want to do the right thing. This is why eventually I think you just take it out of the hands of the states. I mean, you just establish universal healthcare. Because, you can find, again, Indiana, they found some face-saving way to sort of do it without admitting that they were working with the Obama administration. Fine, at least that, in fact, the needle exchange in Scott County basically amounts to